Hi friends, after a short break, once again a warm welcome to my YouTube channel Future Midwife. Today I will discuss about one of the diagnostic tests which we are performing during pregnancy. Have you heard about contraction stress test and non-stress test? Both are performing during pregnancy in order to identify the fetal well-being. So among this, today I will discuss about non-stress test. It is a simple and non-invasive test. That means it is not giving any pain during this test. From the name, it is understood it is a non-stress test. That means we are not creating any stress to mother and fetus while performing this test. Usually this test is performing after 28th weeks of gestation, and also it is best performed after 30th weeks of gestation because the sympathetic and parasympathetic system of fetus will develop properly after 30th weeks of gestation. That's why we will get a correct result after 30th week of gestation. The main principle of this test is in order to identify the fetal acceleration whenever there is a fetal movement. As you know, the normal fetal heart rate is 120 to 160 beats per minute. Whenever there is a fetal movement, it usually increases. So if there is any fetal movement and it indicates there is an increased fetal heart rate, which indicate the good fetal well-being. Here we'll discuss about the purpose of non-stress test. These are assessment of fetal well-being, to evaluate the ability of fetal heart rate to acceleration, to know oxygen supply to fetus, and to know the need of further monitoring and testing. So these are the purposes of non-stress test. Next, we'll discuss about the advantages and disadvantages of non-stress test. So first we'll see the advantages. These are, it is non-invasive procedure, painless procedure, no risk for fetus and mother. It is easy to administer weekly or daily, and results are available readily. Next is the disadvantages. False result often occurs since various methods have been used to stimulate fetus to elicit acceleration in fetal heart rate. Here we can see the indications of non-stress test. It can be divided into two, maternal and fetal. First we'll see the maternal indications. These are postdated pregnancy, RH sensitization, maternal age more than 35, chronic renal disease, hypertension, diabetes, premature rupture of membrane, history of stillbirth, trauma, and vaginal bleeding in second and third trimester. Here we'll see the fetal indications. These are decreased fetal monitoring, IUGR, oligohydramnias and polyhydramnias. In these all aspects, we can perform non-stress test. Next is the contraindications of non-stress test. These are gestational age less than 24 weeks. Any contraindication to labor is contraindication to non-stress test also. Next, we'll discuss about the equipments needed for NST. First of all, we need a non-stress test machine. Then a tray containing abdominal belt, then stethoscope in order to identify the fetal heart rate if necessary. Then we need a jelly or cotton pad. Then we need a graph paper. Apart from that, we need two transducers. The first one is Doppler transducer in order to identify the fetal heart rate, and another one is Toco transducer in order to identify the fetal movement and uterine contraction. So these are the equipments used for NST. Here we'll discuss about the procedure of NST. So before the procedure, it is very important to ask the mother whether she had any food before the examination. If she didn't have any food, we instruct the mother to have the food before the examination. Then advise the mother for voiding. It will prevent the interruption between the procedure. Then explain the procedure to mother. Make the patient sit in a chair or lean back on an examination table or bed. Fastened onto it are two monitors, one to pick up the baby's heart rate, the other senses the uterine contraction. Allow the patient to hold one marker and explain to click each time she felt the baby movement. This monitoring goes on for 20 to 40 minutes. A baby who moves a lot and has a normal heart rate is classified as reactive. He is considered as healthy baby. A non-reactive means baby is not necessarily in danger. The baby could just be asleep. Here we reach the interpretation aspect of NST. So in this interpretation we will get a three result. The first one is reactive NST, second one is non-reactive NST, and the third one is unsatisfactory or suspicious NST. So we will see one by one. The first category is reactive test. A reactive test is one in which a normal fetal reactivity pattern is demonstrated. This is evidenced by fetal heart rate acceleration of 15 beats per minute above the baseline, lasting for 15 to 30 seconds in association with fetal movement. Two or more occurrence of this acceleration pattern within a 10 minutes period or five or more acceleration within a 20 minutes are considered as healthy fetus. The strip of this reactive test will be displayed on the screen. Please have a look on it. In case of non-reactive test, this test is one in which there a persistent decrease variability with an absence of acceleration in fetal heart rate in response to fetal movement. This is evidenced by fetal heart rate acceleration of less than 15 beats per minute above the baseline or lasting less than 15 seconds in association with fetal movement. In case of unsatisfactory or suspicious NST, this test is one which there we cannot interpret because of poor quality of fetal heart rate. If test is suspicious, it should be repeated in 24 to 48 hours. The NST can be repeated and continued at any desired frequency without concern for adverse effect of the fetus. The strip of non-reactive test will be displayed on the screen. You can watch it. Here we can wind up our today's section. So this non-stress test is a simple test which never cause any adverse effect to the mother. So this test we can perform at any time after 28 weeks of gestation, which never cause any harm or any distress to the mother and fetus. So the aftercare and role of nurse during NST will be displayed on the slide. Please have a look on it. So in the next class, I will explain about the contraction stress test. Till that, take care. Bye bye.